on Wednesday. Oh boy, I don't know like many of you. I mean, these days run together or what? We are live on Wednesday, October 7th, 2020, and really excited to have Dr. Casey Blessing here with us today. We're going to be talking about otitis, and behind the scenes, the three of us, Casey, Justine, and myself, we're talking about how many cases of this we are seeing in the ER and general practice and specialty practice. So we're really excited. But you all know that before we get to the meat of the lecture, we love to hear from you. Interact with us. We love seeing where you are logging in from. And we see our Portugal friend. Welcome.
Jose.
Our friends from around the country and around the world. So if you could, please type in where you're logging in from around the country and around the world. My name is Garrett Pachtinger. I'm a criticalist and the co-founder of VETgirl along with Justine. I'm looking out the window now. Thankfully, I'm logging in from fairly sunny and warm Pennsylvania, just outside of Philadelphia. What about you, Justine?
I am Justine Lee. I'm an emergency critical care specialist and toxicologist, and honored to be the co-founder with Garrett. And I'm coming from sunny, 60-degree, blue-skied Minneapolis.
And Casey, what about you?
I am in San Diego, so it's beautiful here. We've had a little bit of a hot spell lately, but always nice and pretty. But yeah, in San Diego, I'm a dermatologist, born and raised in San Diego, and travel all over for school. So yeah, enjoying that. We always have nice weather here, though, so I can't.
80 degrees and perfect.
I know, I'm jealous. Some of my favorite IVEX critical care symposium trips have been to San Diego, just walking around, because it's usually without COVID around this time of the year. And sometimes in places where Justine and I live, it's colder, dreary, maybe a little bit of the winter weather rolling in. And then you fly into San Diego and, beautiful skies, beautiful weather. And then I'm always jealous because, I'm not a night owl. I can't stay up all night. And, right now the sports, the basketball finals are on. They start at 9 p.m. But if I was out in beautiful San Diego, that'd be 6 p.m. and I could stay up and watch them. But as an old person now, I feel like I can't stay up that late. So I catch it on ESPN the next day. But we're seeing people, Tampa, Virginia, Ohio, North Carolina, Southern Cal, Michigan, Indiana. Again, we had Portugal. So yeah, love hearing where you are signing in from around the world. So as you do that, we are going to get our party started today, because we appreciate the time you have taken out of your likely very busy day, where we're also just chatting about how crazy this COVID caseload is. So even more, we're thankful that you've taken the time to, I say have a lunch break, but we all know veterinarians don't get a lunch break, right? You're probably shoving a pack of peanuts and a Diet Coke, or I was joking before of shoving candy corn in my mouth now that it's October. So we know you don't get a lunch break, but eat the Snickers and your peanuts or whatever else you're doing right now as you frantically write your records between cases. And we're going to get the party started with some great information here about otitis. So we're going to be talking about Lend Me Your Ears, tips from a dermatologist to help manage otitis. So let's get the party started. Now, I did want to absolutely thank Merck Animal Health. It was with their generous sponsorship and support, we're able to provide this race-approved lecture free to the veterinary world. And I'm going to talk about how you get your half an hour of free race-approved credit coming up. So stay tuned on that. So please, next time you see your Merck Animal Health representative or you email them, thank them for providing us all this opportunity. If this is your first VETgirl event, what you're going to quickly learn is that we are the tech-savvy way to get your CE. We have webinars, YouTube live events like today, podcasts, blogs. New in 2020, our certificate program and our CE management tool. I want to keep it short, but if you have any questions, shoot us an email. Use that contact form. We can let you know all of the great stuff you get being a VETgirl member. Also, part of that membership is our VETgirl forum. So after this, if you have questions about your otitis cases, if you're a VETgirl member, you have access to a forum where you can ask us questions, get clinical tips, get second opinions, or advice from specialists. So check out our VETgirl forum. And as you all know, we love interacting with you on social media. So whether you like us on Facebook, whether you tweet with us, whether you gram with us on Instagram, please just interact with us. It's a great way to learn when we have upcoming events like this, get cool clinical pictures that we talk about, some gross, some fun, some amazing, but just make sure you please interact with us. Now, importantly, please, if you have your phone out, scan this or screenshot it or whatever you need to do. But Merck Animal Health has an awesome thing coming up. They're in their 2020 Scary Ear Sweepstakes. So veterinarians and our amazing technicians out there, send them your grossest, amazing, wonderful photos of your ear cases. And there are amazing chances to win awesome stuff from Merck Animal Health. So there's a website listed over here. We're going to put this, I think Justine already did put it into the feed
I put it
itself.
in the comment section.
You can use the QR code. I know the phones now are really cool. If you've been to a restaurant during COVID times, we know there are no paper menus. So if you just even put the camera up to the QR code, it recognizes it right away. It opens up that website page, and you can send them your awesome, gross, scary, wonderful ear photos to win some great prizes with Merck Animal Health. So make sure you check that out.
The more pus, the more inflammation, the better. The more likely you'll win. And we won't type that in the comments.
The grosser, the better. I mean, we all know as veterinarians, we love gross stuff, right? It's that, abscess during the cocktail party to get people away from you, right? So send your awesome, gross photos. All right. Now, as I said before, this is race approved. So how do you get your race approved CE? Number one, you have to be watching this live as we're giving it live approximately 12 noon on Wednesday, October 7th, 2020. Comment anything you want, where you're from, what you do, a plug to Merck Animal Health, comment in the feed, and then take a screenshot of that and then email it to AnneMarie@VetGirlOnTheRun.com. Give us about a week just because we're going to verify your attendance, and then Anne-Marie will send you a link to download, print, and fill out your CE certificate. You'll get it directly from us. If a week passes and you don't get it, shoot us a note. We'll investigate right away. Make sure you upload that back to your CE management system so you don't lose it ever, right? But again, comment, screenshot, and email Anne-Marie, and we will get you your race-approved CE credit free, thanks to Merck Animal Health and, of course, our VETgirl webinar this afternoon. With that said, you're not here to listen to me or Justine today, but we're going to be behind the scenes helping you answer questions, so please type them if you'd like to. Who we are here today to hear from is Dr. Casey Blessing. So Dr. Blessing, again, thank you so much for being here with us today. What I'm going to do is I'm going to drop myself and Justine out of the mix. And if you can, give us a little background, again, who you are, where you train, what you do, and then please take it away. The floor is yours. Again, thanks so much.
Thank you. Thank you guys so much for having me here. VETgirl's wonderful. So glad you guys are all here. I will say good morning to all the West Coast people and almost good afternoon to all the East Coast. So yeah, like I said before, born and raised in San Diego. I did my first year of vet school at Ross and transferred into Tufts. Then I did my internship at West LA, VCA West LA. And then I did my 3-year residency training at Animal Dermatology Clinic in San Diego. Then I was fortunate to stay on and stay in my hometown. So let's see, we'll kind of, as Garrett was saying, we're here to talk about ears. I will try to give you a short, 20-minute or so, 25-minute introduction and kind of tips for otitis. As we all know, otitis can be incredibly frustrating and really hard to manage. Otitis, believe it or not, is the second most common reason that dogs will present to the veterinarian, and the first is pruritus. And even with the most compliant owner out there, otitis can be incredibly frustrating and really, really difficult to manage and treat. So we'll kind of go through some tips that we can learn to kind of help you go through things and kind of move forward. So we'll start with briefly talking on anatomy. I promise not to bore you guys too much. There's just a few slides to kind of touch base on a few things. We'll then talk about how to examine the ears, which sounds silly, but it really makes a big difference. And then a little bit about etiology, diagnostic workup, and treatment. So as we're all familiar with the anatomy, there's the vertical canal, the horizontal canal, the eardrum, and then kind of that tympanic bulla. What I do want to focus on and kind of talk about is this tympanic membrane. So we do know it separates the external ear from the middle ear. What I do want you guys to look at is that pars flasta and pars tensa. So that pars flasta is going to become important with PSOM, which I have a few photos later on in this presentation to show you. But I want to let you guys know, as I'm sure you're all very familiar with, deciding whether or not an eardrum is intact is incredibly challenging. There can be super little micro tears. I mean, obviously, if there's a giant, huge hole in there, it's easy to tell. But even with the best video otoscope and the best light and lots of experience, you sometimes can't tell whether or not this eardrum is intact. So let's talk about how to examine. I know it sounds silly, and in a perfect world, we would be able to look at be just like this picture where you're by yourself. The dog is incredibly wonderful. You're able to stick the cone in and look without anyone helping or restraining. This is incredibly unlikely, and it's very rare to happen. So learning how to perform an otoscopic exam is incredibly important, and it takes a lot of practice. It's definitely an acquired skill. I'll never forget my first year of my residency. I was in an exam room with Dr. Griffin. He wanted me to look in an ear. He looked in it, saw something really cool. I went to go look. Immediately the dog screamed, pulled its head back, and as Dr. Griffin pointed out, he's like, well, you don't know how to look in ears yet. So it happens to all of us, and you want to have it try to be the most atraumatic process possible, and you have to visualize where you're putting that cone. So let's go to this next slide. What I want to kind of show you, so here's kind of a side view of it, but you want to straighten the canal, pull the canal over the tip of the cone, and as you pull the pin up, then you kind of pull it lateral and down, and as you advance the otoscopic cone. And the reason you want to do this is when you first look into a dog's ear specifically, you'll look and you'll see this auricular projection. And so this auricular projection, as you can see, if you look in, you really can't see anything else besides this projection. And when that cone hits that projection, that's what causes the dog to scream, wince away, painful. So when you pull up and over, you're going to be able to see actually inside that ear canal. So you can see up in the corner, there's the auricular projection that's pulled out of the way, and you're able to visualize the deeper canal, the horizontal canal, much better. So although it sounds silly, you definitely want to use 2 cones when you're examining. You should never use the same cone for both ears because you never want to seed something from one ear into the other. And it's very common that individual ears will have different infections even on the same dog. Adequate light is really, really important as well. So if you haven't replaced those lights or gotten a new otoscope, I definitely would recommend it because having the light is really, really important. And then as I talked before, restraint. Whoever's holding the patient for you actually has a lot to do with what you're able to see. So training your staff on where to hold and how to hold so that you can visually see the ear and the deeper canal is really important. And sometimes based on the patient, it will require sedation or anesthesia. So the cone sizes are, 3 to 7. And obviously your goal is to try to get the biggest cone in possible without causing problem. And with this restraint, if an owner, or if a technician or whoever is restraining for you and they're scruffing a cat, for instance, they're going to pull up on everything and you won't actually be able to get in there. Also, if the dog's head is cocked one way or the other, you're not going to be able to get a good visualization. And then also if they're holding down below and actually putting pressure down here, you're not able to get into the ear canal as well. So training your staff how to hold can be incredibly important. Here's just kind of showing a little bit different light sources. So the far left one, that really bright light, is the video otoscope, and then the handheld scope is next to it. And then you can see in the picture to the right, the bottom cone is the size 3, and then the upper in between one is the size 7, and then the video otoscope. You can see the different light that's visible or comes out from those cones. So the biggest cone that you can put in comfortably is the best. So, why is otoscopic exam important? And I'm sure you guys are all aware of it, but you're really assessing the canal for multiple things. How much stenosis is there? Is there erythema? Is there ulceration? Is there tons of exudate? Is there proliferative tissue? That can be really, really common, and especially those Cocker Spaniels. And then you're also looking for foreign objects. Here, I'll have you think. Perfect. So these are classic in Southern California. These are these awful foxtails that you can find. And it's really important to look into the canal because these can penetrate the eardrum, get into the bloodstream, get into the brain, and they cause lots of problems here. And so, Garrett, I'll have you hit the next slide if you don't mind. These are what they look like. And again, they're not in every area, but in Southern California, they're huge. And when they're deep into the ear, they can actually look like hair. And so there's plenty of times that you're worried it's just hair, but it actually is a foxtail and vice versa. Then you can also evaluate, for tumors. Is there a big, huge polyp? Is there a growth? And then definitely for excessive hair, you'll want to evaluate those poodles for sure. Do you want to talk a little bit about breed variation? So ear canals come in all different shapes and sizes. Unfortunately, our Cocker Spaniels are really prone to that proliferative tissue, which you can see. Standard poodles are infamous for getting Pseudomonas infections, either whether you pluck or you don't pluck. Sometimes plucking causes the infection, sometimes not plucking causes the infection. Shar-Peis, think of all your brachiocephalic breeds, really stenotic ears just on their own. And then German Shepherds, the canals of their ears are ridiculously long. So there's all sorts of shapes and sizes that can kind of help and or hurt when you're trying to treat otitis. So let's talk a little bit about etiology. Again, I won't bore you guys too much, but there's this great classification system called the PSPP, which stands for primary causes, secondary causes, perpetuating factors, and predisposing factors. And unfortunately, it isn't until you manage all 4 of these that you're going to be able to get otitis under control. Let's talk a little bit about primary causes. This is just a little bit of them. There's a bunch more, but for sure, as a dermatologist, allergy, we're definitely seeing. So your food, your environmental contact. Flea is unlikely to cause a flea allergy, or a flea allergy is unlikely to cause otitis, but I think there's about a 5% chance that it can, but definitely your food and atopy are way more common to cause it. Definitely parasites, Demodex, Otitis, ticks. Cushing's and hypothyroid can definitely cause otitis. Foreign bodies, like we talked about, foxtails. And then your autoimmune diseases and immune-mediated can also cause otitis. And those are all considered primary causes, which actually cause the otitis. And there's secondary causes. So bacteria, yeast, fungal, medication reactions. If there's overcleaning that macerate the tissue, those are all secondary causes. And these by themselves don't actually cause infection. And then next we have perpetuating factors. So there's a ton of them. We won't go through all of them, but is there stenosis? Is there edema? Is there proliferative tissue changes? Is there calcification? Is there dilation of the tympanum or rupture? Is there glandular changes? What's going on with the middle ear? Because if there's a bunch of infection seated in that bulla or in that middle ear, it's going to perpetuate the otitis from continuing to keep happening. And then predisposing factors. So as you can see, there's a ton of them. The conformation, excessive moisture, obstructive ear disease. I do want to kind of show you one picture of this feline African cystadenomatosis. And these are the kind of classic blue lesions that will present in cats, and they're mostly in the ostia, but they can make their way all the way down into the horizontal canal. So those are definitely predisposing factors to causing otitis, especially if that ear canal is blocked. And then PSOM, as we talked about, neoplasia, systemic disease, and then treatment effects can also be predisposing factors. So getting all 4 of these primary, secondary, perpetuating, predisposing factors is what's really important to kind of tackle and address and manage otitis. Let's talk a little bit about diagnostic workup. So obviously the history, like always, is incredibly important. Is it acute versus chronic? Is it recurrent? Are there concurrent signs? So do you have a dog that is, constantly having pruritus to its paws, periocular regions, ventrum, perianal? Are there other signs of pruritus? And do they actually have interdigital erythema? Are there other signs to support allergy that help you kind of know that the otitis is from the allergy? And then of course the physical exam, as we talked about. Where's the inflammation? Is there discharge? Is there proliferative tissue? Those will all help you kind of to diagnose and realize how much you're needing to treat and address. Cytology. I know anyone that has heard from a dermatologist has always said, have you done cytology? It's so important, and it's incredibly fast results, relatively inexpensive. It definitely helps with your treatment plan, and also to see, is your treatment working? Are they improving? Are things worsening? Is there more bacteria, less bacteria? Is there now fungal infections? And it also can help aid in what kind of treatment you want to start based on what you find under the microscope. And we always recommend to sample both ears. You'll never know what you find. Even in an ear that looks relatively normal, there may still be an overgrowth of yeast. There may still be inflammation. And so I think it's important enough to sample one ear. It's important enough to sample the other. So sample collection, I know it sounds silly, but it is important on how you actually sample, because as we talked about before, each ear can have different things, as well as it's been shown that there's different organisms found in even the same location, if not different locations. So vertical canal versus horizontal canal. There's kind of 3 main ways to collect samples. So the cotton swab, which you can see in this picture here. There's also the tip of the cone that you can, once you put the cone in the ear, you can actually roll the cone onto a slide. And then you're also able to do a soft tube aspiration where you can stick an red rubber onto a 6 or 12 cc syringe with some sterile saline, actually put a little bit of saline and aspirate back, or if there's enough exudate, you can actually just aspirate back the material and sample it that way. In order to know what's abnormal, we definitely need to know what is normal. And so what's a normal ear cytology? We'll focus on the dogs here, but the maximum amount of number of yeast would be considered 2.6. And then the maximum amount of cocci that you should see is basically less than 1. You should never see rods. And then inflammatory cells are should never be found. And there was one dog in one of the 10 fields that had some neutrophils, which had a normal ear. Let's talk more about abnormal. So kind of depends on which study you read and what you believe, but anything greater than 5 is considered abnormal. Anytime you see a rod or more, it's abnormal. And then inflammatory cells is always considered abnormal. So any bacteria is considered significant if you do see inflammation or nuclear streaming. And then of course, if there's phagocytosis or toxic changes, that's significant as well. For yeast, it's more common to find yeast in dogs like normal ears. So they say anything greater than 3, and then cats anything greater than 1. Typically for dogs, I'll say 3 to 5 per oil immersion field, as long as there's no inflammation is considered normal. And then of course, other yeast or pseudohyphae is never normal. Mixed infections are incredibly common. So they're, kind of been known as ears can be like kitchen sinks. There can be lots of rods, lots of cocci, multiple types of rods and cocci. And so mixed infections are really, really common. And that's why it's important to look under the microscope to see kind of what is your predominant organism and what's really causing the issue. So again, cytology, you'll hear me say it over and over again, how important it is, because you'll be amazed at what you can find. Of course, there's the classic thing, neutrophils, eosinophils. You can see bacteria, you can see yeast, you can see all sorts of different, organisms. So here's some cocci that you'll see, even some intracellular cocci. There's some yeast. You can see acantholytic cells. So this is at a kind of a lower power field, but if you zoom in, you can see these classic kind of beautiful acantholytic cells, which you can find on cytology. And then if you are lucky, you'll see some fungal organisms as well. And then very rarely, but it does happen, is you can actually find Demodex on cytology. I want to talk briefly about cultures. I think it's a question that comes up a lot, that I get a lot of questions from primary vets about. So let's look here. So with culture and sensitivity, again, it's clinician dependent on when people feel it's important to do. So some people believe that only when there's otitis media and you're wanting to use systemic therapy, that's when you should culture. Some people believe that when empirical therapy isn't working or it's ineffective, that's when you should culture. And then there are some dermatologists that believe anytime you see rods, it's important to culture. Always, always do the cytology before culturing, because if there's yeast, your culture isn't going to grow that. You'll also not know if there's inflammatory cells. And then if there is a mixed infection, you do want to see what is the predominant organism. Is it mostly rods with just a few cocci, or vice versa? I'm just going to go through a few studies kind of looking at cultures. And so this one was looking at 15 ears. It was sampled by loop from the external ear canal. Basically, they were looking at bacteria, rods, neutrophils, or DNA. And then 2 culture swabs were inoculated from the same loop. What they found, so 13 cases grew bacteria. One of the 13, so 7.7%, had the exact same strain of bacteria isolated on sensitivity. So Pseudomonas was grown on 10 samples, but 70% of them had different strains and sensitivities. 5 of Carini were grown, and 60% had sensitivity and strains that were different. And for staph, at that point, it was staph intermedius, not staph pseudointermedius. It was grown on 2 samples, and there was 100% different strains and sensitivity. And these were samples that were collected from the exact same area. And then there was another study done basically looking at the interlaboratory variation of Pseudomonas. And so all laboratories agreed on the presence of Pseudomonas in 18 of the 34 ears, so about 53%. And none of the Pseudomonas species had identical patterns of antibiotic susceptibility patterns. So even when it's sent to the same lab, that's what we talk about. It's kind of these kitchen sinks. And so there was a study done looking at 20 cases of Pseudomonas otitis, and treatment was started empirically while awaiting the culture and sensitivity results. Ear flushing was performed with Trizid-ETA, and we can talk about ear flushing in a little bit. And 7 out of the 20 had pure cultures, and 13 of the 20 had mixed cultures. Of the 17 cases that completed the study, 11 cases had sensitivity reported resistant to the antimicrobial empirical chosen, but 10 of those 11 were treated successfully with only the topical. So what this shows is that appropriate therapy may not be utilized based on the culture and sensitivity results. And I wish we had more time, but we don't, to talk about radiographs and CTs and MRIs, but those are kind of another diagnostic tool that you can use besides cytology and otoscopic exam. Let's talk about treatment. I know we only have a few minutes left and we're having to kind of rush through this. So sorry guys, if you have questions afterwards, we'll answer what you can, but I can't overemphasize the importance of flushing. It's very rare that you can get a otitis cleared up without flushing. So there's kind of 2 types of ways of flushing, at least in the clinic. So using a bulb syringe, which you see here, as well as this is Dr. Bourgeois, who's showing kind of the tube technique, and we'll kind of zoom in a little bit so you can see. So you'll hold the otoscope cone and you'll actually feed the red rubber that's attached to a syringe with saline or water, and you actually use the tube flush to flush everything out. And it's amazing the amount of material that you can get out. But really, flushing is so, so, so important when you're dealing with otitis. And then we talk about if you're ever worried about otitis media and an owner can't afford anesthesia, if you do sedation to do a tube flush, we try our best to put the patients in a position similar to this. That way everything is draining down. So to protect those patients that weren't able to do anesthesia, especially because you don't want any of that nasty bacteria from that ear going down into the lungs. So this is one way to hopefully help protect them, but ideally anesthesia and intubation is recommended for otitis media, but in those cases that you can't, positioning the patient can make a big difference. So there's tons of topical medications out there. This is kind of a chart looking at you'll see Post-Etex on top, then Mometamax, Otamax, Serolin, Tresiderm, Claro, and Osurnia. Their antibiotics are fairly different, and the antifungals are different, and then the steroids, some are the same. What I do want to point out is that of all of the topical medications, the only one that has posaconazole is Post-Etex. And what's great about posaconazole is it's a fantastic antifungal. And there's been some studies done looking at kind of the in vitro antifungal activity of posaconazole, nystatin, miconazole, and clotrimazole. And what they found is that posaconazole was the most effective antifungal for solid and liquid methods. So you can see here the MIC 90 was 1 to 2 micrograms for posaconazole, where it was 16 to 32 for clotrimazole and greater than 32 for miconazole and nystatin. So I love Post-Etex, especially when you're dealing with those nasty recurrent yeast infections. So topical medications, yeah, they can be absolutely wonderful, and their concentrations are much higher than achieved by systemic routes. Hence the kind of discussion on whether cultures, how you interpret cultures. And they're often much higher than the MPC that are given on those. And then there is this synergy between the combination of the antibiotic, antifungal, and the steroids. Of course, you need to have a patient that's amenable to topical therapy, that's not going to attack their owner, that won't be attacking you. And the owner has to be able to medicate in order to get this done. I do tend to prefer topical medications that are daily because we're usually asking our owners to flush the ears. And with the long-lasting medications, you aren't supposed to flush. So a lot of times for our kind of really chronic, hard to treat otitis cases, I'm using medications that are daily. And then glucocorticoids are kind of go hand in hand with otitis because of the amount of inflammation and pain and proliferative tissue and stenosis that can happen with otitis. Glucocorticoids, both systemically and topically, are really, really important and can really help you get these kind of chronic cases under control. So for treatment duration, you don't want to stop treatment too soon. Recheck the exam and cytology. That's super, super important. Anytime I'm treating otitis, I recommend them to come back in 10 to 14 days for a recheck exam and a recheck cytology to make sure you've actually gotten rid of the infection. Although clinically the ear might look better and seem better, there can still be residual infection, so a longer treatment course is needed. And then sometimes the ear loses its ability to self-clean, and that's what we need to kind of find out because that will help or kind of cause recurrent infections. So teaching the owner how to clean and flush at home is really, really important. And then pets with perpetuating and predisposing factors may require long-term or lifelong maintenance therapy, as well as hopefully addressing the underlying cause of why the otitis is happening. So thinking back to that PSPP system, figuring out what that primary problem is really important. So when to turf, definitely, if there's polyps or masses, if there's PSOM, that kind of dilated pars flaccida, if there's any neurologic symptoms, if there's severe stenosis, and if they're not responding. And I have a few pictures of some absolutely horrible ears that would need to be turfed for sure. And then topical reactions are definitely common. I think we're running out of time here. So the main thing for topical reactions is you want to stop all things topical, rinse with water and saline, oral steroids. And one of kind of the symptoms of a topical reaction is if you see a ton of inflammation with no bacteria on your cytology. However, I will say that if the infection's more in the middle ear, that might also happen. So it can be very tricky to figure out, is this topical reaction versus just an otitis media that's not being controlled. And ototoxicity is always a big topic that happens. Unfortunately, almost everything can cause ototoxicity. So it's a conversation that you have to have with the owners, warning them about the risk, but usually the infection is what's more important to be treating and get under control. So in summary, otitis is definitely incredibly challenging. You want to try to find the underlying cause, do a cytology, please, please, please. Remember how important it is to flush those ears, treat the secondary infections, and it's really important to recheck. I'll open it up to any questions if we have time.
That was fantastic. Thank you so much, Dr. Blessing. Bunch of great questions that we're seeing out there. Before we talk about that again, I just wanted to give a huge shout out again to Merck Animal Health for being able to provide this free YouTube live event. And I hope you guys enjoy it. Please type in any comments. We'll make sure to pass it on to Merck. And the main reason why is because we want to be able to provide this in the midst of COVID when people can't travel to vet conferences. So hopefully you like this format. Again, everyone watching this live on Wednesday, October 7th, gets half an hour of free race-approved CE for both vets and vet techs. You do have to screenshot right now the image of the video plus your comments. Email it to AnnMarie@VETgirlOnTheRun.com, the information that you see on the screen. And with that, give us about a week to get that link to you. The link to the PDF of your CE certificate will be in that email. So please make sure to read that email. If you have AOL, Hotmail, please make sure to check your spam folder, especially if you have a .net or anything like that. All right, Dr. Blessing, some fantastic information that you provided. So important that you reiterate the importance of cytology. And wanted to ask you a couple of questions. First question, I know you briefly talked about it, to pluck or not to pluck. What are your guidelines as a dermatologist? I think people are totally confused on this.
It's super hard and can be really hard. So you have patients, a lot of it depends on history. So if a dog, well, let's kind of talk about our standard poodle. If there's a dog that routinely got its ears plucked and then ear plucking stopped and then it got a raging Pseudomonas infection, then that's a dog that the hair is actually needing to be plucked. If a dog was not having its ears plucked and then all of a sudden got them plucked and then broke with a Pseudomonas infection, then that's a dog that shouldn't have its ears plucked. So the hard part is that each dog is different. So sometimes the hair can actually be protective where you actually want to leave it there where it helps protect against infections. Sometimes the act of pulling and removing those hairs actually causes so much trauma and inflammation that the infection happens. So typically I'll do whatever was working prior or stop whatever was done right before it happened. So unfortunately, it's not a 100% this works and that works. It's patient independent. And so it's getting the history of when it started. And then if you're not sure, try one. And if that doesn't work, you try the other.
All right. Great answer. Thank you so much. Now, one more comment before we take a couple more questions. Don't forget to enter the Scary Ear Sweepstakes. So you can see this QR code. You don't even need a QR code reader anymore. You just need to use your camera and move it up to the QR code and it will take you to the URL. And you can upload your really purulent, disgusting, pussy otitis cases. I'm not going to type that in the comment because, you know, the purulent word will be marked as like violation on YouTube. But Garrett just brought up that slide. So again, make sure to enter that and you will enter in for a chance to win a
a dog behavior monitor. So definitely want to check that out. Merck is going to be giving away 10 of those. All right, a couple of other great questions that I see, especially with curbside nowadays. How do we actually show an owner how to appropriately clean an ear? Is there a video of it, or how do you do that? And what do you do in a dog that's really painful?
Right. So I'll answer the second part of that. If the dog's super painful, sedation is absolutely imperative, because you won't be able to get very far. And it's especially for those ulcerated, eroded Pseudomonas infections, you're not going to get anywhere unless you sedate. So dextometer, if obviously the patient's cardiovascularly safe and age appropriate, and sedation is huge. A lot of times we aren't able to get what we need until we sedate. So sedating for that aggressive or painful patient is absolutely important. Curbside, yes, definitely very hard. So we have been working with Animal Dermatology Clinic to be getting videos available. So we've had to actually show owners on videos how to start allergy immunotherapy. There are some great ear flushing videos. I just don't know if where they are like uploaded. I'll have to ask our staff, but I'm pretty sure we have them on Animal Dermatology Clinic's website of how to flush.
Great. Thank you so much.
Yeah, it's just animaldermatologyclinic.com.
Wonderful. Thank you so much. Now, a couple great questions about, like, if you're having a chronic otitis case, what's the duration of how long you're going to have a pet owner flush for ears? So what's your normal spiel? You're going to flush once a day for a week or two? And how many like chronic otitis episodes will you tolerate before you recommend referral to a dermatologist? Because I agree, it's frustrating for the pet owner. So oftentimes it's better to get them to a dermatologist before they give up completely, right?
Agreed. So ear flushing is typically, in a really bad case, we'll recommend it once to twice a week, because you don't want to overflush. You can actually macerate and kind of destroy some of that tissue. So usually we'll get it nice and clean and flushed out, whether it be sedation to bulb while they're there in the clinic, and then have the owner continue with once or twice weekly ear flushing. And then kind of for maintenance, that unfortunately depends on the patient. Some patients need ear flushes twice a week, every week for the rest of their life. Sometimes once a week for a few months, and then they're able to taper to every 2 weeks. For those atopics that it's seasonal, definitely during their season, you would want to flush more. And then what was the other part of the question? Sorry, Justine, I forgot, was how long is chronic?
Yeah, when to refer to a dermatologist.
Yeah, so I think, if it's a one-time event that happens once a year, probably unlikely. But if you're seeing a pet that's breaking with ear infections 3 or 4 times a year, there's definitely something else going on. It's not just a one-time event. So I think if you're seeing it habitually over a span of a handful of months, it's definitely worth at least trying to work up the underlying cause, because most likely it's not getting better on its own. It's going to continue to keep happening.
Yeah. And I will say my own dog, who's a pit bull mix, has chronic otitis, especially after he swims in the Mississippi. It's super frustrating. He probably has atopy. And it made me a lot more empathetic about how to clean ears and what pet owners have to deal with. I'm also going to encourage you emergency people out there, because of COVID, like if a dog is coming in for one thing and you notice their ears are disgusting, I've seen some cases where people just triage them away. They're like, make an appointment. They are not going to go back to the vet. It is so painful, right? A lot of behaviorists, one of the reasons why they see dogs being aggressive towards a kid is because the kid is grabbing the ears and the ears have otitis. So please, let's make sure to treat this. It's chronically painful for the pet. And we want to make sure that our patients are comfortable.
We've even been able to have owners actually use trazodone at home for dogs that are like really resilient to, or not wanting to have ear flushes, just because they remember what it used to feel like and there's kind of a pain associated with it. And we've actually had trazodone work really well for our patients in the clinic too. That, granted, if it's incredibly painful, you need dextometer and torb to actually help, but to help at least be able to visualize and look, trazodone has really been wonderful for us.
Wonderful. All right. We try to keep these to 30 minutes because we know you guys don't get a lunch break and you're probably getting CE while eating and doing medical records at the same time. So thank you guys all for attending today. Again, please make sure to screenshot. You get half an hour of CE for both vets and vet techs for watching today's live event. If you are a VETgirl Elite member, you can watch it passively as a recording on our website. But just please be aware, if you want your CE, to go ahead and screenshot right now. If you don't know how to screenshot, please Google it really quickly. And then when in doubt, please email that to AnnMarie@VETgirlOnTheRun.com. Don't forget to enter the Scary Ear Sweepstakes to win. And to get a huge shout out to Merck Animal Health for sponsoring this. And a huge shout out to all of you guys. COVID-19 and curbside. It's been so hard for all of us during this whole thing. Before, we were just talking to Dr. Casey and Garrett. We're so busy right now, and everyone's really overwhelmed. And we never get a shout out or a pat on the back, but thank you guys for what you do and for keeping all the pets healthy, whether or not it's from, saving a GDV to treating that chronic otitis to preventative medicine. So important. And you guys are rocking it right now. And with that, thank you guys so much. Wear your mask, wash your filthy hands, and everyone be safe. And don't forget to vote.
Yes, absolutely.
Have a great day, everyone. Bye-bye.
Bye, guys. Thanks so much, VETgirl.